Hi everyone, I'm DeMeo Cook. I'm a research assistant professor at the Wheelock College of Education and Human Development, and today I'm going to be talking about early education policies that affect our youngest children and their families. So recently, a piece on the site EdSurge posed a provocative question. What if finding childcare online was as easy as making a dinner reservation? The article discussed how technology was being used in different states to make things easier for families. These initiatives are somewhat promising in addressing just one of the key issues in accessing early education, simply finding information about what programs exist, where they are located, and if they actually have any openings. It's certainly appealing to think that in the few minutes it takes to make a dinner reservation on OpenTable could be translated to finding the perfect preschool for your 4-year-old or bilingual family childcare program for your 1-year-old. Families that I have interviewed through my research have discussed the great lengths they have gone through to find this information, with some creating spreadsheets, sharing them with friends, sharing them with their neighbors. Even where online systems do exist, they often lack key information such as cost, hours, specific language and cultural programming, and live data on the actual program openings. I've also spoken with many families who actually had no idea where to start, and many of them talked about how they accidentally found out about, say, the free Head Start program they were actually eligible for from a neighbor or friend at the park. But finding information is only the beginning, and as many of you know, choosing the right early education experiences for your children is not really the same as going out to dinner. So in the US, early education programs serve young children and their families from birth through kindergarten entry. Unlike the K-12 education system in our country, early education is considered a non-system. It's made up of multiple provider types, including family child care providers, who are typically run out of individual homes, center-based programs, and programs in public schools. Programs are funded through a very complex set of braided and blended private and public funding. And also, unlike K-12, we don't treat early education as a public good in the United States, and as such, we do not invest anywhere nearly enough public dollars to ensure access for everyone. For reference, even federally funded programs for families with low income do not come close to serving all eligible families. And these are things like Head Start, Early Head Start, the Child Care and Development Block Grant. And also, not only that, but these programs don't serve middle income families who also face great challenges paying for and accessing early education. In the absence of substantial public investments, early education programs are forced into the private market, competing for families who are consumers, and in some ways this is like restaurants. But this is too simplistic, obviously. Understanding how families make decisions within these constrained contexts is complicated. The U.S. Department of Health and Human Services has defined access to early education and that it should be only taking families reasonable effort to find, enroll in affordable programs that meet both their child's developmental needs as well as parents' work needs. I have studied this topic with research teams and policy and practice partners in multiple settings across the U.S. My research, as well as others, consistently find that families weigh a complex set of factors and that their preferences and choices do change over time as children age, new children arrive, and family work needs change. For example, in research conducted in partnership with the Vermont Agency of Education, we analyzed state data from over 5,000 children who were enrolled in the state's free preschool program. We found that geography and availability certainly played a role. So for example, in areas where there were less programs available around the child's home, we found that families were more likely to enroll in lower quality rated programs, public school programs, and programs further away from their home. In local research here, in partnership with the City of Somerville, we used multiple data sources, including district administrative data, surveys, and interviews, to better understand decision-making in their context. Family characteristics, such as whether the family spoke languages other than English, were low income, and had a child with a disability, predicted the type of program the child was enrolled in. Combined with interview data, we found that families with these characteristics faced multiple barriers and felt that they had much more limited choices. So as you can see, this is certainly not as simple as making a dinner reservation. So I'll just close in saying that the bottom line is that we certainly can improve access without substantial public investments, and not just in the programs, but also in the workforce. The workforce faces many of the issues that Judith talked about for elder care. It's very similar for early educators. Families certainly need more information and more ways of accessing. Stephanie, you talked about administrative burden and work requirements. All of those hold true in this setting as well. And this area is certainly ripe for lots more research that is interdisciplinary, so I'm interested in collaboration, so I hope to talk to many of you.